Okay.
All right, hey, this is Josh, Dream Body Clinic, and I'm here with returning patient Denise. Hi, Denise. How are you doing?
I'm good. How are you?
I'm doing great. So you're back again, and last time you were here, you did quite a few treatments.
Yeah.
What all did you get done last time?
I got both knees. I got thyroid and the 100,000, I think, of the IV.
100 million.
100 million.
Yeah.
100 million. Yes. Yep.
Yeah, and I
Big
think your husband Mark, he did some too.
He did prostate and he did the IV also.
That's awesome. So you're back again, doing your knee today, and then we were also doing, what else did we do?
The intrathecal.
The intrathecal, that's right.
Yep.
So how did things go before?
It was amazing. I didn't really have any expectations the first time, and I had significant pain in both knees. I had intermediate thinning under both patellas. I had arthritis on the femoral notch on both of them, scarring on both MCLs, and I had meniscus tear in the right one. And I think it's been 9 months. So I just got the MRI done again, and I knew my left one was fine because it didn't hurt anymore.
Awesome.
And it's 100% normal cartilage.
Wow.
No MCL scarring, no arthritis in either. And the right knee went from intermediate thinning to mild. And meniscus is healed. And,
that's a huge difference.
Big difference, 9 months.
That's super cool.
So I wanted to try to get the right one at 100%, so that's why I came back.
Oh, that's awesome. Well, thanks. Now, question, because we do always curious. I mean, did you just do our rehab protocol? Did you do any different supplements, anything to kind of help speed things up? Or just
I
give it
did
time?
the type 2 cartilage.
Okay.
I don't know if it helped or didn't help.
No, that's actually
it didn't hurt. It didn't hurt.
I bet it helped. We're seeing that a lot from patients.
Yeah.
We like to think of the stem cells, they're like the manager on the construction site. But you need to make sure that they have the bricks to build the house.
Yeah.
And that's why I asked. We're actually consistently getting feedback like that back from patients that are taking these collagen supplements and seeing them regenerate faster. And people aren't seeing that from just a supplement. So the combo seems to be the perfect thing. That's incredible. Yeah. So very cool. And then what about with the other treatments? Like
the intrathecal, I thought about, is that what?
Well, no, before. Like, because you did your thyroid too. Like, how's your thyroid doing?
I couldn't tell a difference really with the thyroid.
Okay.
And my husband couldn't tell a difference with the prostate.
Okay.
But I can't say it didn't help.
Have you seen, like, compared the numbers before and after, or no? Like, did your blood work look different on the thyroid?
It's the same. No, it's relatively the same.
Yeah, that's what's tricky with the thyroid, is if it is autoimmune based, it's like almost always like just fixes it, but when we don't know if that's quite what's causing it, it's a bit
when I did it, that's what you told me. You said it wasn't going to hurt, but
it might work, might not on that one. It's tricky to know. Yeah. Okay, great. So this time we did only the right knee because that one wasn't quite there, and then the intrathecal. Like, how did that? That's a weird one, right?
It feels strange, and a little bit of pressure down there in your lower back. But other than that, it wasn't bad.
Yeah, I think I always joke it hurts mentally more than physically.
Thinking about it, when she said loosen your muscles, I didn't know I could tighten those muscles back there.
Yeah, but it's pretty easy. So now you'll just kind of rest the rest of the day. We'd recommend go back, lay down, let the spinal cord fluid flow. Okay. It's easier to do if you're laid down. Okay. And we'll see there, and hopefully you'll be much smarter next time you come back.
That's what I told my husband. I'm gonna walk out of here a genius. So.
Well, that's awesome. Well, thank you so much for coming back. Yeah. Thanks for sharing that. It really helps other people to know, like, hey, my knees are bad, but there's a solution other than surgery.
It is, absolutely. And most people in the United States, they don't believe it.
Yeah, it's tough for them to comprehend. So fortunately, we can do it here. They can't do quite the same thing in the US. It's really with the culturing, the replicating of the cells, but because of that, we're able to help a lot of people. So
it's amazing, actually. And it's everything that I researched, so it's great. It's nice that it can be true.
Good. Well, thank you so much. Thanks for sharing that. And for you at home, like, if you'd like to learn more, you can get a hold of us at www.dreambody.clinic or call us toll free at 833-445-9089. I'm Josh. Happy to help.